Kryssa Cable, I'm a chiropractor. Before chiropractic, I had a bachelor's and then a master's degree in biology. I did studies in immunoparasitology, and then I found chiropractic. And since I got my degree, it was 17, 18 years ago, I think at this point, I continually study. I like to study all forms of chiropractic, energetic ones, neurological ones, SOT, cranial work, intracranial work. I keep studying. Acupuncture is my latest. I got my degree in Florida for that. So I keep studying and keep learning, and I keep applying it to my patients as I go. So let's get started. Brain supplementation for ADHD. All right, so it's about 11.4% of the population in kids, about 6% in adults. It's the most common psychiatric diagnosis in children and in adolescents. Some show it to be more common than anxiety in adults. So there's a lot of this. We're looking at a lot of ADHD in the population. So I wanted to start with some case studies. So this is a child I worked with from the age of 6 to, I still work with him. He's about 15 or 16 now. So a lot of what we're going to look at is the head tilt. You'll start to notice these if you don't already in the population. A right head tilt is what this guy has, and this comes to be very related with ADHD, and I'll get into the reasons why that is later on. But in the picture that's on the left, he's about 9 there. I was working with him from about 6 or 7, and I think he's about 9 in that picture. And then in the right, that's recent. He's 15 or 16 there. So when he was 6, he was in kindergarten. He was diagnosed with ADHD. He could not sit still. His teacher worked with him beautifully. His teacher really wanted to help this family, and the family really did not want to put this guy on any kind of ADHD medications from Big Pharma. So they brought him to me. I adjusted him. I did cranial work on him. I did exercises with him. I did supplementation with him, and he made it all the way through into high school. His parents, his family actually put him into a private school because he was doing so well and he's so intelligent. And he now is so motivated in school that he wants to be a lawyer. So this is a guy who could not sit still in a chair. He was on a wobble board in the back of his classroom. His father ran him to school and ran him home just to get the energy out of him so that he could try and focus during school. And now he's 15 and ready to commit to a lot more school to be a lawyer. So I think that's great. This guy still tests for serologic, and he still uses serologic. It still helps his brain. This is another little guy that I worked with for torticollis. So first, third, and fifth visit, you can see how the head tilt resolves, right? So a little bit straighter each time. This guy has really low tone. You can tell from his mouth, it's kind of drooping, and also his right foot is turned out, which is a spasmed psoas. So again, we're looking at more flexion in the right psoas, or flexion in the right SCM, flexion in the right psoas. And this is something that should be resolving at this point. He really shouldn't be having that kind of a flexion, right? When babies are born, they're born in the fetal position, and it's all flexion. And then as they grow and the brain matures, you want to see less and less flexion. You want to see them open up. With this guy, I did cranial work. I was doing chiropractic adjustments. He was too young. Mom wasn't breastfeeding, and I lost track of these guys, so I'm not sure how this guy's doing at this point. But his head tilt was resolving really nicely with cranial work and some of the other work I was doing with it. So this is plagiocephaly, or flat head syndrome. So if you look at his back right, occiput and temporal bone in the before picture, you'll see that it's flat in that area, right back in here. So what's going on is he's got torticollis, right? He was born with torticollis. He was a cesarean section. So born with torticollis, pulls the head to the right. It's pulling the SEM is pulling through the temporal bone, and it pulls the occiput as well. And so it flattens his head there. So then he ends up with plagiocephaly. So I worked on this guy for a couple of weeks. We supplemented the mom with methylcin. ADEK comp would have been great, but I didn't have it at that point. But had I had it, I definitely would have done that. So this guy is currently about 3.5, 4, and he's on track to go into school. So he's doing really well. And as you can see, the plagiocephaly resolved. Okay, so another plagiocephaly in the back this time on the occiput. And I worked with her for a while. We fixed the plagiocephaly, but she was not nursing and I couldn't supplement her. So I still know this child and there are still signs of ADHD. So what I'm seeing is we can fix the skull, right? We can fix the plagiocephaly and the torticollis, but if it's not supplemented, sometimes I see that ADHD isn't really resolving as much as I would like it to. Now, again, she's still young, so it's not a full ADHD diagnosis, but there's still some evidence that it might be hanging around. All right, so let's talk about why this is this way. Brain growth. The infant uses up to 60% of the total energy in their body goes to the brain. 20% of that is what would happen in adults, right? So infant brain is using 60% of total energy available. It's about 20% in adults. So the brain is needing a huge amount of nutrition to really grow. At this point, when the baby's born, you basically have the brain stem that is functioning. They call it suck, swallow, breathe. All the child needs to be able to do is suck, swallow, and breathe to be born. That's what is necessary, and hopefully that's happening. And if it's not happening, obviously, this is where you're going to get NICU babies and they could be having nursing issues. There's a lot of trauma in hospitals, right? So when they're pulling on the head, things can happen. This can inhibit the way the child can breathe, the way the child can swallow. And if that happens, one, it needs to be fixed. The quicker it's fixed, the better. But also, you might be heading more down the path towards ADHD, right? Because the more trauma, the more things we have to fix, the more that's going to impact the brain. And if we have a brain that's starving, it's going to be more and more difficult to fix it. So the brain is growing at a tremendous rate at this point. So when the baby's born, the brain is about 25% of the adult brain. And then by the time they hit 5, it's 90%. So it's a huge explosive growth. And they have to have the nutrition to be able to feed that. Otherwise, the part of the brain that's growing, which is really going to be the frontal brain, it's going to be from top down. Higher levels of cortex are going to start growing, and that's important because that suppresses the lower brain. So lower brain is what puts the child in flexion. Lower brain is the reflex brain, the fight or flight brain, the survival brain, and that's what we want to try and dampen as the brain grows. So we want to make sure the brain is fed with all the nutrition it needs, all the stimulation it needs, all the oxygen it needs, so that it's not compromising the growth. If the growth is compromised, there's going to be what's called escape of reflexes, and the child's not going to be able to control that movement. So with babies, there are reflexes that are tested. A rooting reflex is when you touch the cheek and the child will turn towards the motion, right? Whichever cheek you touch, the baby turns the head. There's a palmar grasp. So if the palm is touched, they'll close over your hand, right? That's a palmar grasp reflex, and that should be there in an infant. But as they grow, those are supposed to disappear. So if you have a 6-year-old who is having escape of the reflexes, and the lower brain is still strong and still firing, and the upper brain is not growing fast enough to suppress those things, every time they touch something, it's going to kind of overload the brain. It's going to kind of fire them, right? So if their cheek gets touched, it's there, and it doesn't necessarily look like that, but it feels like that to the brain, right? So there's going to be movement. There's going to be movement that these kids can't control. And that's a lot of what ADHD is. You've got these reflexes that are not being suppressed by the higher brain. The brain is about 50 to 60% fat by dry weight. So fat is incredibly important for the brain. Fat soluble vitamins A, D, K, all E as well, all very important to feed the brain and help it to grow so that it can suppress lower brain. So a lot of this research that was started by Weston A. Price, who looked at traditional diets versus modern diets. And what he saw was that populations that were consuming nutrient-dense traditional foods had lower rates of mental illness, lower rates of behavioral disorders, and they were neurodevelopmentally just, they were better. So there's a link between nutrition and brain function. So we want to make sure these kids have plenty of fat-soluble vitamins and nutrition for them to grow this brain. So let's go to the next slide. I think okay, so traditional diets will produce a broader facial structure with improved dental health. The reason this is important is because the bigger the airway is, the more oxygen you can get down the airway. So if they have a narrow palate and the dentition is crowded, this makes the air space in the mouth smaller, and not just in the mouth, all the way down into the lungs gets narrowed down, not just from the narrow palate, but also with a narrow palate, you're going to start to get an anterior head carriage. So you're going to start to close the airway this way. So then we have a narrow palate and we have an anterior head carriage, and the child's not getting the oxygen they need to fuel the brain. So if we have a population that's consuming modern processed foods, sugar, white flour, poor fats, then we're going to have more increased tooth decay, increased behavioral problems, increased mood instability, and increased or decreased impulse control. So this is exactly what you're looking at for ADHD. So through pregnancy, it's important that these moms get plenty of fat-soluble vitamins, plenty of nutrition, the less sugar, the less wheat, the less processed food, the better. The more traditional the diet is, the better. And that will help the brain to be able to grow. And of course, while they're breastfeeding too, this is huge to feed the infant, because that's when the frontal brain is really going to start to grow and suppress the lower parts of the brain. So while they're breastfeeding, this is incredibly important as well. A lot of moms, like once the baby's born, they relax and it's like, oh, now I don't have to worry about it. You do have to worry about it. It's incredibly important because now you're growing the upper parts of the brain. So the better the diet is at this point, the better the brain will grow. Okay, so this is a slide of a SPECT scan from a normal brain and a brain that was from an ADHD child. So on the right, you can see the lack of perfusion in the right prefrontal cortex. It's in the left too, but a lot of it in the right. This is consistent with ADHD. This is what we find all through the studies. And the size of the prefrontal cortex is actually 3 to 10% smaller as well. So left brain, right brain. Let's talk about, we're going to talk about right brain a lot because that's the side that's more compromised in ADHD. So let's start with that one. The right side of the brain is the spatial side of the brain. It controls the posture and gait. So it controls movement, and it controls the child being upright. It controls balance and proprioception. It's nonverbal. It's the nonverbal side of the brain. And it's also the pacemaker side for the heart. So it controls the speed of the heart. So it will also control the immune system by suppressing the sympathetics on that side, although that happens on the left side too. The left brain is more of the detailed side of the brain, more language and verbal, and it controls the rhythm of the heart. So if you have a heart rate that is arrhythmic, this is coming from the left side of the brain, generally speaking. This side also controls the HPAT axis. So there's still going to be some sympathetic suppression, but more of it happens from the right. All right, so when you see the deficiencies on the brain, Let's talk about the right side of the brain, because the right side of the brain is again going to be more of what you see in practice because of how disruptive it is. So the right brain deficiency, the child is not going to be able to feel where their body is in space. They're going to have poor muscle tone and poor gait, delayed gross motor skills. They're going to have lack of attention. They might be able to read, but they're not going to be able to interpret it. It's going to affect their smell or taste. They're not going to be able to interpret people. Deficiency on this side of the brain is going to be diagnosed as ADHD. They're going to have poor digestion, rapid heart rate. So if you have a left brain deficiency, which honestly, I'm not sure which is more common. I'm not sure if one is more common than the other. But on the left, it's nowhere near as disruptive. So you're not going to see this. You're not going to see it in your office. You're not going to see it as commonly because they don't realize it's not as much of a problem. They're not looking for as much help. But a left brain deficiency is going to be a child that's shy and withdrawn. They're going to appear to be sad or depressed, slow to speak. They're going to have reading problems. They're going to be concerned with their appearance, but they might be really good athletes. They're going to have arrhythmias. And this is in all likelihood going to be diagnosed as a learning disability. So much more of what you're going to see is going to be a right brain deficiency in your office. Okay, so this is the way this works. The frontal brain, as the frontal brain, the prefrontal cortex is growing, it's going to fire down through the hypothalamus, through the midbrain, through the pontomedullary reticular formation, and it's going to go down into the spinal cord. And this is where it's going to, from there, go out to all of the organs and shut down, you're shutting down the sympathetic pathway. So this is what should be happening, right? When the frontal brain is growing, this fires all the way down through the spinal cord. The child will start to straighten up, and the child's body should appear to calm down, right? They're going to gain more control. If this isn't happening, you're going to have sympathetic escape. You're going to have continued flexion. You might have the right head tilt. And this is an indicator that the brain is not growing at the speed that it needs to be growing. It's lacking something. It's lacking oxygen. It's lacking nutrition. It's lacking stimulation. There's something there that's not allowing it to grow and suppress the sympathetics and the lower brain. So these are some articles on the prefrontal cortex in ADHD. I'm going to summarize these up, and this is obviously just 3 of them, but I wanted to give you guys the names of them so you have them, and then I'll summarize. So prefrontal cortex, it's the regulatory hub. It's top-down regulation of attention, motivation, emotion. So this is what's controlling all of this in these children. So if you look at the circuitry in some of these kids, the neurodevelopmental disorders show abnormalities in this area, right? We looked at that in that SPECT scan that was from the Amen Clinic. There's also reduced blood flow in the area. So the size of it's going to be smaller, and then there's reduced blood flow, there's reduced gray matter in that area. So this is more on the prefrontal cortex. It's again, linking ADHD to the right prefrontal cortex in particular. It's impaired top-down control. There are other areas that are involved, like basal ganglia and cerebellum too. Yes, they're involved, but primarily everyone, big pharma, is looking at stimulating the prefrontal cortex to get the attention to increase. All right, so what are they doing for this? Stimulant and non-stimulant drugs. There's some examples in here, right? Clonidine, Concerta, Adderall, we've all heard of these. So if we look at the stimulants first, these are stronger generally, and the goal is to increase dopamine or norepinephrine, depending on the drug, and to stimulate the sympathetics. You're actually stimulating the sympathetics and raising blood pressure. So you're stimulating this part of the brain, but you're also, the way these drugs work, you're stimulating the sympathetics. So now you've got a brain on this child that is, now it's stimulated, but the sympathetics are still super high. To me, it kind of sounds like a bomb would be, going off in there, like the having all of the sympathetic stimulation, and then this brain that is like trying to shut it down, but can't do it. So it's almost like it's making it worse, probably in the brain of these kids. The non-stimulants, They lower the heart rate and they do reduce sympathetics. They take longer to work, but they are lowering the sympathetics a little bit. So it's a little bit better for these kids. They're not getting the brain stimulation, but at least they're not getting the sympathetic overload. So the side effects, the stimulants, again, they're going to work stronger, but they're going to have more side effects. They're going to have decreased appetite, insomnia, increased heart rate, tics, anxiety, headaches, and emotional blunting. And if you've ever seen these kids that are on these drugs, it's really hard. It's almost like they're Parkinsonian. They're not interacting with you, right? They have no affect in their face, and they're so flat. It's very hard to watch. The kids on non-stimulant drugs, it's a slower onset. They might have GI irritation, liver issues, suicidal thoughts are possible. And then these kids, because of the depressants and the vasodilation, they're going to be tired. Possible constipation and fatigue. And again, the emotional blunting is going to be possible there. All right, so postural patterns that are associated with ADHD, and I know I've talked about these a little bit, but I wanted to go over it again. So the way it works is the right frontal brain is not inhibiting the right flexors. So you've got the right SCM, which will pull the head down to the right. So if we have a reduced right frontal brain, we're going to have a spasmed right SCM, and the head's going to tilt. You can probably also have a spasmed psoas on that side, and the right foot might be turned out. You're going to have increased reflexes. The neonatal reflexes are still going to be hanging around. And this is all because this frontal brain is not growing here. So when you see this in children, what you might want to think is we have a brain that's compromised, and we need to feed that brain. We need to stimulate that brain. We need to get that brain oxygen. We need to get that brain nutrition. So what is going to worsen this? We have a lot of devices that we put babies in and put babies on that really impacts their ability to straighten up and develop the right posture. So anytime you upright a baby, you're exposing them to gravity, and that gravity is going to pull them forward. So for instance, in the baby bumbo, which is the little seat in the lower right corner, they give these to 3-month-olds, and they'll try and sit a baby up in these little chairs, and they have no muscle control at this point. So everything just comes forward. So in forward they come into flexion, and also jumpers. I don't think this is usually for like a 6-month-old. They'll put the baby in a jumper, but they're working. Then the baby starts jumping, and they're working with gravity. So they're exercising all this flexion into their body, and this can make the posture even worse. I've seen kids come in like, I mean, they truly have like an anterior head carriage because they've been in a jumper, jumping up and down like crazy and pulling everything forward. So those are very bad. The walkers, you can see on the little girl that she's got her shoulders up and hunched over. She's forming that anterior head carriage and the shoulder forward posture right there. Car seats are, yeah, they're terrible, especially when they fall asleep in them this way. I realize that those are absolutely necessary and we have to use those, and there's no question about it, but you just don't want to leave them in there any more than you have to. And certainly fix the head forward posture if it ends up looking like that. Well, let me talk about the mouth open posture. So sleeping on the back. Babies should be sleeping on their stomach as long as they have the tone to be able to turn their head from side to side. If the baby doesn't have the tone to do that and they cannot turn their head from side to side, then they should not be sleeping on their stomach. But tummy time should be used slowly until lots of other things, adjustments, right? Exercises, PT, to get the child to be able to have the tone to turn their head from side to side. But if the child is neurologically normal, they should be able to turn their head to the side and go to sleep. When they're laying face down, it allows them to push the diaphragm down further. So long COVID patients, they found out they did better if they turn them on their stomach and and kept them that way. And they had no reason for it. Well, the reason is it depresses the diaphragm and their lungs can fill with air a lot easier. So they don't have to force the air down. They just inflate easier. This is the same thing with the babies. So if they're on their stomach, they can inhale, they can get much more oxygen. The brain is going to be happier that way. Turning the head from side to side is actually what creates the neck curvature. So that's a good position for them to be in. They should obviously be turning back and forth. They're not going to be stuck one way or the other. Crawling. Okay, so crawling, by the time the baby gets to 6 months, they should be able to crawl. This was actually pulled it out of the developmental milestones, and crawling is no longer in the developmental milestones. So basically what they're saying is, oh, the child doesn't have to crawl. This isn't neurologically important. That's incredibly wrong. It links the right and left sides of the brain. It's very important that the child crawls and crawls normally. There's all kinds of weird ways that children are crawling, mostly because their movement is improper from the beginning. And so so neurologically, they're not able to crawl, but they should be crawling by 6 months, and that will link the right and left side of the brain. It develops the glute, and it helps to help them stand up straight when they get to that point, which is at about the earliest. I mean, I've seen babies walk at 9, 10 months. And a lot of times, again, babies are not walking until they're 12, 18 months. I hear this all the time. Again, because the movement is compromised from the very beginning. Okay, so chiropractic adjustments affect the prefrontal cortex. It's been shown that it stimulates that area very well. They used EEG localization and looking at the brain processing, and it increases after chiropractic adjustments. So these are amazing for the brain. I think as chiropractors, we all know this. Okay, so exercise to help to improve this prefrontal delay. A lot of what kids are doing now is computers, right? We're looking forward, we're looking up and down. This is how we spend the day. This is how we're spending our night right now. We're staring at a computer screen, we're looking up and down. This is how the brain is being stimulated. The movement that kids need is much greater than that. They need to be spinning and turning and moving side to side and developing these postural muscles so that they can stabilize their spine and stabilize their neck and stabilize their brain after that, because that's what fires into it. These muscles are what's going to fire into the brain and help to stabilize it and shut down the anxiety, right? Shut down the sympathetics. So if you're constantly looking up and down, this is stimulating, again, there's many different aspects to this, but let's just talk about the anterior canals of the vestibular system. So it's in the temporal bone in the ear, and there's 3 different canals, anterior and horizontal and posterior. And with the anterior canals, they're picking up movement that goes like this. So these are getting all kinds of stimulations, but the horizontal canals and the posterior canals are not getting stimulated at all. So this is what's going to fire in to the brain, in through the cerebellum and up into the frontal brain, and drive the frontal brain to shut down the sympathetics. When kids are not moving like this, then they're not getting this to fire in, and all they're getting is anterior canal stimulation, and the sympathetics are just gonna keep going up. They're never going to be calmed down because we're not firing into the frontal brain. So what do they need to be doing? They need to be outside moving. They need to be moving side to side. They need to be spinning. They need to be turning and looking behind them. This movement, turning and looking behind you, especially with your eyes. If you just look like to your side with your eyes, and you will feel your posterior neck musculature back here fire just by looking with your eyes. Put your hands back there and then look with your eyes, and you'll feel those muscles move around. So what's happening is when you're spinning and turning, you are driving all of this neck musculature, and the amount of proprioception that comes from the suboccipital muscles is greater density in the suboccipital muscles than it is anywhere else in the body. So these are having a tremendous capacity to fire into the frontal brain and to drive the frontal brain. So when this is not happening, when there's none of this motion, the brain is basically going, what's going on, what's happening, It's in sympathetic mode, right? It's panicking. So what these kids need to drive this part of the neck musculature and drive the brain is movement. They need to be spinning. They need to be dancing. They need to be doing monkey bars. They need to be catching and throwing a ball. Anything where there's hand-eye coordination, where they're throwing a ball, or they're catching a ball, or they're, dancing and watching their hand. This develops hand-eye coordination, fires the frontal brain, and calms down the sympathetics in the body. This is also incredibly good. Monkey bars in particular are really good for the shoulders, because we have the shoulder development, we have the shoulder anatomy of chimpanzees. So we're supposed to be able to swing through the trees like this. And when we're not doing it, the shoulders aren't going to be as healthy. So take the kids to the park and get them on the monkey bars. This does an incredible thing for their brain and for their shoulders and for their posture. So again, they're following, right? They're following hand-eye coordination with their eyes and with their hands, and this is driving the brain, and this is what these kids need. So what this is going to do is it's going to teach them to track. So reading side to side, again, if we're on a computer, we're only going up and down, right? Reading side to side is tracking right to left, or left to right, right? Whatever. And to be able to do that, they need to exercise this in the field before they can sit down at a desk and learn to read. So to teach these kids to read, what they really need to be doing is tracking a ball or tracking their hand, instead of being sat down at a desk and going up and down, because this is not developed in them at that age. And 6 is, for boys, when they're going to kindergarten at age 6, it's pretty young for them anyway. This should be developing more like around 7. So you're pushing it with these kids anyway. And then if they're not getting the exercise and they haven't been getting that kind of stimulation, these eye muscles are not ready to read. So you can sit them down with a teacher all they want, but they can't follow this. They can't do this. So it's very, and what's that going to do? That's going to increase their stress even more. So now we've got a brain that's not shutting itself down, and now you're driving even more sympathetics, and that poor brain is going crazy inside there again. Okay, so how are we going to get these kids nutrition that they like? Leptera is excellent for it. I always put my kids on this. They like it. It works great for them. Nursing mothers can have it. You can start them on it early. Again, we've got to stimulate the brain. We've got to think about 3 things: glucose and oxygen and stimulation. So we're getting them here. We're getting them great glucose, great vitamins, great fats for driving the frontal brain growth. ADEK, I haven't used this too much because it's brand new, but this is starting to go in my protocols, and it definitely would have been in my protocols before if I'd had it. This is, again, the fat-soluble vitamins. This is great for nursing moms. If the child's old enough and they can swallow this capsule, that's the only thing with this, is it is a capsule. We can't do it in a liquid. If they can swallow this, then this is fantastic to feed their brain with all the fat-soluble vitamins in one capsule. Intelimem, this is one of my favorites. This is one of the ones that tests most for me. It has ginkgo in it and bacopa, which stabilizes the blood sugar. The gotu kola in it really drives the frontal brain. All of these herbs have been shown to drive the frontal brain. And I have this show up more than I think any other of the Inno-Vita supplements for a child that's having either a right or left brain deficiency. Serologic, this is what that child is still on that I showed you. Serologic shows up, it usually shows up for me in older kids. It's got ashwagandha, so it's going to help with the sympathetics, and the go-to cola again. So you're driving the frontal to suppress sympathetics again. I see this show up in combination. So I'll do mitochond with something else. It doesn't usually show up on its own, but I'll use it together. The Japanese knotweed really increases the cerebral blood flow. So if you have an anterior head carriage or a military neck, I didn't talk too much about that, but anterior head carriage is shutting down the oxygen supply, right? But it's also shutting down, or the military neck, which is a straight neck, right? Cervical kyphosis, or a straight neck that doesn't have the normal cervical curve in it. That shuts down circulation to the brain. So to help to drive the circulation to the brain, this works really well for that. And again, I usually use it in combination. Also, to drive circulation to the brain is the spinning. So this, any turning and looking to the back, again, helps to drive those postural muscles and helps to increase the cervical curvature. So that's it. That's incredibly important for these kids too. Okay, optimogen. I see this one show up. It's usually in older kids, but and I think that might be because of the St. John's wort. It's one of those that I probably wouldn't use this with a 2-year-old just because of that one. But intelemem is usually what shows up when the kids are really young. Optimogen, I've seen this show up in the older kids. And this is another one that I'll use in a combination. So it doesn't usually show up on its own, but I'll combine it with something else, maybe add it to the intelemem or add it to the mitochond and prescribe them in unison. Phloxy, this one tests a lot. It's got red ginseng in it, which is well researched in ADHD and really tends to help these ADHD kids a lot. So red ginseng and the rhodiola, and this one has the ginkgo and the ashwagandha. This one I see test a lot too. I still see intelemem more, but this is probably the one that I see show up in second place. Circulate. This can help to drive the circulation to the brain. So if you have a child that has, in particular, a lot of anterior head carriage or military neck, then circulation to drive that circulation into the brain and get the oxygen and nutrients circulating more. Heart flow, again, I use this with older kids and I use this carefully, right? You don't want to upset a mom. Sometimes moms can be sensitive about, my child has a heart problem. No, your child doesn't have a heart problem. It's just the herbs that are in here are really, really good for the brain as well as the heart. So this will help to drive the circulation into the brain again. And it's excellent, like I said, for older kids. Cardiar is another one I use for older kids. Again, this has the alpha-ketoglutarate in it, which is a muscle builder. So it's not something I would want to use on a 6-year-old, but on somebody who's 14, 15, this could be a really great way to get them to take their supplements, because this is actually a muscle, it's part of a muscle builder. So like a 15-year-old boy would be happy to take that, right? So you give him intelemem or serologic with Cardiar, and then he'll be super happy to and compliant with his homework. Okay, so these are some of my references. They're accessible through the internet, through books. So if you guys want to do research in particular on your own, those are the 3 where that I would suggest. Any questions? Yeah, I would say absolutely. Crawl, the cross crawl is very necessary. That's what links, that's why crawling is so important. That's what links the right and left hand sides of the brain. That's why if there's a crawling issue, if a child is like military crawling where they're using their elbows, or I mean, there's lots of different weird crawls that are out there, but they need to be up on their hands, and they need to be up on their knees and toes with their toes underneath of them. That's going to drive the glutes, and that's going to set the sacrum so that when they come standing upright, they have the postural strength to do it, right? So that's how they start strengthening the glutes, is by doing the crawling and cross crawl pattern. And then yes, it's got to be a right left. The right hand should be linked with the left foot and otherwise, so that it's again it's driving the right and the left side of the brain together, right? And if you don't get that, then yes, they don't have the brain doesn't develop that connection. And I didn't talk too much about the corpus callosum, but the corpus callosum in girls is a lot bigger. So there's a lot more interaction between the right and left side of the brain in girls than there is in boys. So this is one of the reasons in ADHD, you tend to see it a lot more in boys, because girls can communicate more between the right and the left half. The boys are much more spatially oriented, and they depend more on the right side. So if the right side is faltering, then you're going to see more ADHD in boys. It's one of the reasons. I've looked at it. So I've looked at it both ways. I've tested it on kids, and looking at the herbs, and it doesn't seem to be the best choice. It doesn't seem to. You can always test it and see, and maybe you find differently. Maybe there's a case that it's different, but when I've tested it and looking at the herbs that are in it, I haven't seen it. And it was one of the first I went to, right? Because it's like you would think you want to calm the child, right? But the way the pharmaceuticals work is to stimulate it, right? So you want to actually stimulate the brain, and that's what pharmaceuticals are doing. And not that that's the end all be all, and we have to follow that, but the way they're going after it and the way it works and shows up in the studies is to stimulate the brain, not really to calm it down as much. So, I mean, by all means, test it and see, and let me know if you find a case that's different. I'd certainly be interested, but when I've looked at it, it hasn't tested for me. And then for omega-3 fatty acids, yes, I will look and see if they're in need of those too. I think there were some studies that showed that red ginseng and omega-3s in particular work really well together for ADHD. Yes. The sphenoid, absolutely. The sphenobasilar joint, absolutely. Yes, I work on the head all the time. I work intraorally too, to release everything in there through the lateral pterygoids. Absolutely. Sphenoid's incredibly important. Yes, yes, it's a fantastic book. Yes, it's great. And then there's also Real Food for Mother and Baby. She's based a lot on Weston A. Price. I can't remember if she was a chapter leader or not, but Real Food for Mother and Baby, it's smaller and it's very digestible. And yes, they're both amazing books. Yes, I have them both, and yeah, use them. I knew this question was coming. I would go college entrix. I would do that, and autophagenics. I would go more that way. I would start that way, because you don't really want to stimulate the brain at that point. With autism, it's more about toxicity. So we got to get the toxicity out of there and get things moving more. I would recommend more to start with the extracellular matrix, start with autophagy, and get that area moving better, and get the whole body moving, right? Because there's going to be a stagnation. There's stagnation in that, and it's got to get moving. So I recommend more of that. And then I would look into things like methylsin and Tox-X to help to dump everything out. Yeah, I wouldn't stimulate the brain. I mean, always I look at a child and I muscle test, like I always do. And if I'm not finding it to be one way, of course I would go look for IntelliMem, but my instincts would be to go let's clean up first. Clean up, and then we can move on to stimulating and growing.
We sometimes forget one very important thing. We have organs in our body. Of course, we have a body here. Mm-hmm. But that one organ in the body that doesn't have a muscle, brain. Mm-hmm. Brain doesn't have muscle. Mm-hmm. It's composed with a fat, protein, so on and so forth. It doesn't have a muscle. What does it mean then? Do you remember the TCA cycle where the energy is being produced? It's happening in the muscle. So if a brain doesn't have a muscle, where is it going to get the energy from? Where is it going to get from ATP from? That's why we made that glycol product. So the energy, ATP, is being produced without going through TCA cycle, which is happening in the muscle. and the brain doesn't have a muscle. So if you really need to provide energy to the brain, your glycolysis has to work. Otherwise, you don't get the energy from anywhere. Okay, so we can't forget that. Okay, so if your brain is not getting enough ATP, maybe you may have to check a glycolysis. Okay, because that's the only way the brain get ATPs, because it doesn't have a muscle where the TCA cycle is happening.
Agree with that, and that's one of those, and I always do that too. I'm always working with diet. It's one of the, it's really out there though. So I wanted to focus more on brain, which is why I went this way today. But yes, I absolutely agree with you. I always look at that too. There's not really a commercial multivitamin that I like. I would do, I do methylsin. It's a liquid, and that's B vitamins. And then, if, hopefully you can get them on the ADEK if they can swallow a capsule. That's usually the way I go. But methylsin, I start that. I have nursing mothers on that. I always support nursing mothers with that so that they have plenty of B vitamin. And that's, obviously driving so many systems in the body. So that's one of the ones I start with, and I try and keep them on that all through pregnancy. Thank you.